Continuing on with other terms, acronyms, medical lingo that you're going to come across, and you're going to have another set of questions on there. Again, you've got a couple of places and they are repeated, so you want to make sure that you have those marked sufficiently in your study guide. Okay, you have accept assignment. Again, this is accepting assignment means the doctor agrees to accept the insurance carrier's approved amount as payment in full. Access, having access to health care. We have beneficiary. It's the insured person. Your clearinghouse is a central data bank used for the purpose of submitting and error checking electronic insurance claims and conducting other EDI transaction. We already talked about co-payment and co-insurance. Your CMS 1500 is the universal billing form used and accepted by most insurance carriers. Your diagnosis code is your universal code that describes the illness, injury, or disease. Evaluation and management is your professional services provided by the physician and healthcare provider for the purpose of diagnosis and treating diseases and illnesses. We have your fee schedule. It's a list of predetermined prices or payments for medical services. Again, your HCPCS. These codes are generally used to describe services or supplies that are not covered by CPT, and these are for both provider and non-provider services. Medicaid, government health insurance program for poor and medically indigent. Medicare is federal health insurance program for retired and disabled. Your modifiers, they help to, they're appended to codes to change, further enhance the description without changing the actual CPT code or creating a new one. Patient information, that's your demographic. It's a form completed by the patient that contains personal demographic information. So your social security number, date of birth, your address. Release of information. It's the patient fills out the form. Their signature indicates consent to release the information necessary for settlement of insurance claims or for others to view the insurance. The super bill is a form that lists basic information, the actual services rendered, and diagnosis of the patient. Super bill, depending on what you looked at in Cengage, you could have went through a super bill where you were actually selecting certain services. The UB04, also called UB, is the universal billing form used to submit hospital charges. So our revenue codes versus the other. See if there's anything else. Third-party payer. We've already discussed that. So that's just a few more. Again, we have a couple of different places with your acronyms and your lingo, other terms that we use in the healthcare. Keep in mind that the entire study guide does not contain every single bit of information. So this particular part, you may have to Google certain acronyms or abbreviations. We've talked about electronic health record and electronic medical record. Electronic health record is your complete medical record for multiple areas of service, such as your emergency department, your inpatient hospital record, your radiology, your lab work. It all goes into one condensed area, where the electronic medical record, your EMR, is for a single location. Meaning you can have multiple doctors in that location, but it's for a single doctor's office. So electronic health record, EHR, is for the comprehensive. The EMR is for a more specific specialty chart. Okay.